Hi, my name is Rowan Pierson. I'm a member of the class of 2022 and concentrating in the School of Public and International Affairs. This presentation is going to be a reflection on the virtual internship I completed for 10 weeks during this past summer at the Peace Corps Office of Global Health and HIV, otherwise known as OGHH. So just to start off, during my time at OGHH, I worked closely with the Youth Health and Wellbeing Specialist and the Maternal, Newborn, and Child Health Specialist on a variety of projects, including specific work providing programming recommendations for youth obesity reduction and prevention, specifically focused on increasing physical activity, improving nutrition, and figuring out ways to limit factors that influence an obesogenic environment. With the maternal, newborn, and child health specialist, I worked specifically to highlight the achievements of the Ending Preventable Child and Maternal Death Agreement with the United States Agency for International Development, and the impact of this EPCMD agreement on individual posts and the members and staff of individual posts. So coming into the internship, my objectives and goals were primarily to learn more about the work that Peace Corps does in the field of global health. And then, from a personal standpoint to get a feel for what opportunities exist in the fields of global health and a flavor for what career paths and different work is available in that field and what that looks like, and at the same time to use my skills and my abilities to produce resources, tools, and work that will help Peace Corps and the Office of Global Health and HIV in particular to most effectively deliver its programming and most effectively contribute to the communities it's involved in around the world. So during my internship, my work profile consisted primarily of assisting the youth health and well-being and the maternal, newborn, child health specialists on several projects that they were already working on, along with taking on some individual projects, which included reviewing existing Peace Corps materials, developing new Peace Corps materials, and then compiling information and resources to make those resources and information more accessible for headquarters staff, including those specialists in the Office of Global Health and HIV, for post staff, and then for Peace Corps volunteers on the ground. And so in this middle box, you can see kind of a full scope of all of the work I completed this summer. Towards the top are some of the larger projects that I carried out through the entirety of the internship, including an extensive literature review of best practices for adolescent physical activity, nutrition, and obesity prevention. And this kind of lit review is going to guide the Peace Corps programming moving forward as they develop new training packages to train volunteers on teaching and creating interventions for these different areas, as well as influencing how Peace Corps views adolescent physical activity, nutrition, and obesity prevention moving forward. I also developed the Stories of Change report, as I mentioned previously, to highlight post-experience working with the EPCMD agreement, and the individual reflections of health specialists and health leaders at posts who worked with EPCMD and how EPCMD changed the outcomes for maternal, newborn, and child health at those specific posts. Some smaller projects included reviewing and proposing changes to the Youth Sexual and Reproductive Health Outcome Survey, which is used by Peace Corps headquarters and posts to evaluate the success of and maybe even the gaps of the interventions that they're carrying out. I also conducted meetings with members of 11 different youth health development and youth health and well-being posts to assess kind of what resources they were using for alcohol, tobacco, and other drug prevention, youth physical activity, and youth nutrition, so that headquarters and OGHH can get a better sense of what gaps exist, what best practices are being used, And that is going to help OGHH moving forward to best assist posts in their missions to improve the individual communities they're a part of. So it was a great summer, especially given all of the circumstances, the fact that Peace Corps had never done an individual or in virtual internship before, that I had never done a virtual internship before. I think we were able to work together really well without any major hiccups or challenges. And so it was, a fantastic and productive experience. And looking ahead, I think, it opened my eyes to what a future working in global health and government might look like. Definitely gained a better understanding of how Peace Corps functions, having had friends and mentors who were former Peace Corps volunteers, getting a feel for what the life of volunteer is like, but now having had this experience, seeing what the organization looks like from the headquarters standpoint and from the programming, training and evaluation standpoint, I think really gave me a much better sense of Peace Corps' mission and its role in the world, and was a fantastic experience. And I really look forward to, one of the best parts of the internship was the mentors that I met and gained through the experience. And I really look forward to continuing to foster those relationships, both personal and professional, moving forward. So to lean on those resources to help me as I kind of figure out my future career path and future, potentially working in global health or government. So kind of just to conclude about the internship experience, I gained, new research skills and experience, specifically creating, what goes into creating an extensive literature review, better skills organizing and presenting information using Excel and other different mediums and softwares. So that was fantastic. Definitely gained a better understanding of kind of working with youth and adolescents and what sorts of specific concerns need to be addressed when you're creating programming for youth and adolescents. And kind of in particular, what sorts of interventions are effective and ineffective, and what work needs to be done for reducing and preventing non-communicable diseases, with specific, focus on obesity prevention and reduction. And then finally, I really gained a better appreciation for the challenges and specific challenges for Peace Corps as it works across posts, in many different countries, social contexts, cultural contexts. And so, figuring out how to create programming that can be adapted to each of these different contexts and that can take into account each of the different challenges, barriers, obstacles, concerns, networks, things like that. Was really eye-opening, and I think is going to serve me well as I move forward with my education at Princeton and then beyond that. And finally, I'd just like to take a moment to thank Peace Corps, the Office of Global Health and HIV in particular, my supervisors, Amy Wurzburg, Aaron Lawless, Roman Nelson, who were wonderful to work with and really became fantastic mentors for me and people I really hope to continue to work with moving forward in the future. And I'd also like to thank the Center for Health and Wellbeing for sponsoring my internship in global health. It was a fantastic, productive summer. I really learned a lot, and I think I gained a lot of valuable experience. And it was, really, great for me to be able to do this internship, despite the fact that I was not able to go to DC and given all the circumstance, the current circumstances in the world, it was really great to be able to have a meaningful and productive experience that I think helped me grow and helped me move forward. So that was wonderful. So yeah, thank you.